And we are with Tara Lawal and Jody Lynn Owen. They are the co-founders of Rainier Valley Midwives. I want to thank both of you for taking a minute to talk to me. First, for people who don't know what you do, tell us a little about it.
Well, we're a community-based midwifery services here in South Seattle and Renton. We offer pregnancy care and also wraparound services for pregnancy. So we have doulas, lactation services, postpartum doula services, mental health services here, and social work.
And I was going to say, it's not just all the stuff leading up to birth, it follows after birth as well, yeah?
It's birth and beyond. And then now we have a lot of families who don't want to leave after their birth, so they are going into care with the pediatrician. So we have a pediatric service now, and then we do well person care, so we can serve anyone who wants to stay with us long term.
That's amazing. And it's not just that a woman might have to come here to give birth. You can, if they want to do it in their home, you can do that as well.
Or the hospital. Yeah.
You can join them in the hospital too.
That's wonderful. We don't attend their births in the hospital, but we do send a doula with them, and they work with physicians that we work closely with who rotate through here. So they're with a physician that they know and have met in a warm relationship inside their healthcare experience here, not having to traverse that rocky road all the way up to the hospital and, the difficulties of attending a clinic visit. And we have a lot of families that just cannot miss work. We have a lot of barriers with regards to transportation. And so having providers come here and show up here and just act with incredible kindness and a lot of generosity, and the families feel that, and it helps them feel that they have a safe entryway into the healthcare system.
So when you had mentioned, like, when people can't miss work, are you offering services outside of normal hours in order to accommodate for that?
Yes, we offer evenings, and we do a lot of home visits. So if people can't get to us, or they can't miss work and they can't get to us at night, we will get to them. We will find a way to get to them. And it's just an extraordinary thing to be a part of when somebody asks a question and you're allowed to say yes, and they express their need and you're allowed to hear them and respond to it and elevate their need to a colleague or a partner in the community who can help them resolve whatever is going on with them. We can't always fix the stress people have, but we do a lot of work to learn how to cope with the stress that you have in your life and to support you through like this episode of your life. And it's very uplifting to be a part of as a provider. It's very nourishing to be somebody who's in this role and a part of this team, to be able to care for people in this extraordinary way.
And I think you just hit on something important, because bringing a new life into the world is a joyful time, but it is also stressful, isn't it?
Absolutely.
Yeah.
Yes.
I look, and I love how the both of you are not afraid to show your emotions and that they come to the surface.
Yeah.
Because this, I can see where it's heavily emotional experiences for all involved, for sure. And Jody Lynn, I can't remember if it was you who said it, because before we sat down there was an earlier discussion, but somebody had used the term desert. Mm-hmm. In terms of, was that you that mentioned that in terms of maternity care? Tell me about what's going on.
Yeah, South Seattle is a healthcare desert. We're federally designated, medically underserved. We have a provider shortage. Those are designations of our community, and yet we have the most diverse community here with the most languages spoken in this zip code in the entire country. So we have this wonderful variety of humans here. We have a lot of big families here. We have cultures who support big families. We have joy around family. Mm-hmm. And we don't have the healthcare infrastructure to support it. We have Neighbor Care doing incredible work here, and us. And
Odessa
Brown just came in to do peds. So, none of us are really big enough to do, we all have to work really closely together. And to support the families that we serve, but this is a neighborhood that has been typically incredibly marginalized, and every single thing about it is hard. It's hard to get here, it's hard to leave here. The roads get narrow. Rainier Avenue, Martin Luther King, they get narrower and narrower physically, so just leaving here takes longer. I think at one point when we first started, we were we tried to take the bus to Swedish. It was maybe an hour and a half from here, and that's how you're supposed to sit on a bus for an hour and a half with maybe probably your toddler to get to a prenatal visit. Well, people just were choosing not to go, and then they arrive for their birth, and then they're getting checked in, and all you hear is this: "Oh, if only we had this. If only we had that. If only you had gone to that visit. Oh, we're just missing this too. What are we supposed to do about you? We're gonna have to give you all this extra, extra, extra. What a burden you are to us." Well, that's your welcome. That's how you just welcomed somebody in. That's how you chose to spend your time greeting somebody and thanking them for arriving in the healthcare system. And then they had to have their baby, so they just want to have their baby and get out. And really, we were seeing whatever the fastest way to do that, to get in and get out, that's what they were choosing, the parents were choosing. That's not good enough. We can do so much better, and we owe the families here so much more than that. And that's why we started. We wanted a place where the first rule was to be kind, and then we kind of figured we could hire people who would know to do the rest. But if the boss is like, the rule is we start with kindness, let the rest unfold, that's your welcome. Welcome.
Yeah.
How can we serve you today? Not, this is what I like to, I tell all our families this, is that when you go into the big healthcare system, you have your family and it's whole. Whatever this is, wherever you're from in the world, this is whole. But when you go into the healthcare system, they ask you, please arrange it so it fits through the spaces that we allow in our healthcare system. But here what we say is your family is whole. We respect that. We honor it. You deserve dignity around the wholeness you've achieved in your life. Well, how can we come in and support the structure that's already there with healthcare that we can provide that means something to you? And what does that mean to you? What is healthcare to you? What is health to you? And then we're going to build something together. And that's how we start prenatal care. That conversation. We don't start it with look at all these things you've been missing in your life. We wish you did more. We need you to do this. You're not allowed to bring this person here. We don't trust you because one time 10 years ago there's something written down about you, and now everything we do is going to be informed by that messaging, which we see a lot of. This is not how we behave. We behave with total kindness and respect, and then everything comes to where it's supposed to be.
See, and that makes me think about, and I mentioned to you when my grandson was born in a hospital, and they were treated very well, but I breathed a huge sigh of relief because they allowed my son-in-law and my daughter's mother to be in the room together. We thought there was only going to be one person. Again, it was very, 2 months into the pandemic.
Yeah.
But I mean, that was such a huge deal for her to have her mother there with her. And that brings me to something, Tara, I wanted to ask you about, because you were also talking about, with different cultures, the value of having everyone in the family or many people in the family around to support during the birth. Would you talk about that a little bit?
Absolutely. There's something when you're laboring that you have to do, and you have to let go. You have to let go of, sometimes the pain that you're holding, and sometimes this pain comes in every contraction. And the moment that they let go and they allow labor to just happen, and they allow their body to do what they're supposed to do, that's when they can finally get at peace, and they can just let the baby come. But if you're so scared and you're being told you have to do it my way, you can't eat, you can't even sip water. Sometimes they'll let you have ice chips, and you're just sitting there and you're scared and alone. It's so hard to have your baby, and you start to clam up and you start to just please like, and this is my own experience. I just could not do what they asked me to do, and um, your family comes in and they rub your feet, and my cousins were there. Jody Lynn was there. I think I had 7 doulas all around me in my labor at the hospital so that I could let go. Otherwise, you just can't. You just want to protect your baby. You just want to go into this cave, and just you're like, when can they just come out in kindergarten? and you need your family. You need your support system, and we don't know this. And the pandemic really showed us people thought that's how you have to live your life. Like you have to create your little pods and be, alone. And we saw so many people isolated during that time, figuring like I'm in this by myself with just my husband who knows nothing. and it was so hard. And now trying to undo that and allow people to let other people in and to allow your family to come in. People nixed their parents from coming to see their kids for 2 weeks. They were like, nobody can come in if you didn't have this, and this. We need this, and this. So they're taking those protocols from the hospital and putting it in their home and having COVID tests and negatives, and that just changed everything about the way that we need to be as humans and as family. And trying to get back to the family, it's hard. And trying to be able to support one another as your family, it's hard. Family relationships have struggled through this pandemic, and trying to figure out how do we become a family. That's what we're doing here. Our business is actually creating families and having people
we have
going
so
to
many
parenthood.
clients who say that to us, where they'll say, I don't have my family anymore. You're my family. I'm not leaving. A lot of the people you see working here had their babies here.
Yeah.
And they don't leave. And then we have, the number one predictor of health outcomes is loneliness. So how are we going to remedy that? Not with a 7-minute visit, but if you know you have a place to land and you're going to sit down and lean back in your chair and be heard for an hour, it's like very bolstering to the human spirit, and that bolsters health. And I think that you just bring something up that's so important of what is a community anyways anymore. Like what, as a society, we're totally redefining it. I have a crazy story that I'm trying to think of as relevant. Well, you can delete things, right?
Sure.
Okay. Because I was in an accident. I was hit by a bicycle from behind, and I broke a bone in my face. I looked like a murder scene. I looked like a murder scene. This was on the sidewalk in West Seattle, and where I was going for a walk. That's what people are supposed to do. And I had to walk back to my car. I walked 2 miles. I looked like a murder scene. Not one person looked at me. Not one person saw me. And as I was going, I was thinking, is somebody... I got a lot of adrenaline, so I didn't know how bad I was hurt. And I was walking. And then I started looking people in the eyes. Nobody looks at each other anymore. We have lost our humanity. And I think that, that experience just... You look when somebody walks in the room. You look when somebody is coming towards you and smile and say hello. And are you okay? And how are you doing? And if somebody looks sad or they're crying, you can stop and ask them if they're okay. That spirit is very strong in here. And you might notice similar behaviors even in healthcare systems. You can walk into a room where there's a doctor and a nurse, and you go in. How many people look to see who's come in the room? Not very many. Well, like our most basic human curiosity about each other is somewhere else right now. And we have to turn towards each other again. And I think that process is very tied into health outcomes. It's very tied into how we listen to people when they say they don't feel well. And if we are dismissive, women die. And that is the story of the United States maternal mortality. I would put it down. It has nothing to do with the women. They're not doing anything wrong. The fundamental problem is that listening. We don't know how to listen to each other anymore. And that is carried all the way up the ladder. And people are just talking over each other. And the whole system is like, whoever is the top dog is just eating the next person down and down it goes. And till everybody who's supposed to be around the patient taking care of them walks into the room having just been yelled at. How do you take care of somebody when you're like freaking out on the inside because your boss just screamed at you, because their boss screamed at them and their boss screamed at them? And how do you not scream at somebody? You don't. You shut down and then you just kind of do your work and you go home. That's not okay.
And they put another person on your panel for the day. And now they're required to see 25 to 30 patients in one day. You just can't. You literally cannot see that many. And what's so crazy is, like, just yesterday, I saw a chart note from somebody who dismissed a person with a horrible knee injury.
In another clinic.
Sorry. I just saw, and it was just, here, just go do rice, rest it, elevate it, ice it, and take some Tylenol. And nothing else, because she didn't have time to do anything else. And
and that's so somebody's parent and somebody's child and somebody's sister and somebody's brother.
Who can't
and now
walk.
They're home
Who
limping.
can't walk.
How can you get the groceries and how can you go to work and how can you function? Yeah. And it's listening. You can't listen in 7 minutes. I mean, you can.
Yeah, it's like assembly line healthcare. It's, one of the other things that's totally unrelated, but I'm sure you've seen this push toward, freight rail safety with the derailment in East Palestine,
absolutely.
Ohio.
Yeah.
And these inspectors who are supposed to be doing inspections on the rail cars, they get 30 seconds aside to inspect, like 185 different points on the thing. What you're talking about for healthcare is no different.
No, and those are engineers who've been in school for a long time. They know a lot of math. They can use it all really well. And you're right, it is the same thing. You have exquisitely trained providers who start their first day in medical school, nursing school, midwifery school, with a vision of tending to people who are hurting or suffering or who want to achieve their best health. And by the time we graduate them, that's been chased out of them. It has been run out of them. There's an idea in healthcare that the more you know the person who's in front of you, the less professional you are.
Oh, right.
How is that? Where did that come from? I never sat with a person in a visit and was like, I wish I knew you less. I could be so much better at giving you what you need today. That's not, and it's not, I am not at all denigrating the people who are in those positions, who are walking that walk. I understand that the system has done this, and there's some larger, and that's why having Senator Marie here today is just so impactful, because there's larger work to be done to dismantle that. We need support systems for the dismantling that build just as quickly as we're taking things apart. We cannot just destroy things, we have to build things. And I think that I'm hopeful. I mean, with somebody like a partner like CHPW, they're a very big partner for us in Washington State, and for all birthing families, frankly, to have somebody at that level they have money and they can do things and they just build. They're like, what can we do today? Let's do it.
And you're given the letters. Who are they?
Community Health Plan of Washington.
Okay.
They're a nonprofit payer. So they have Apple Health clients, they have Medicaid members, and we meet with them and they're like, what do you people need? Well, the same thing everybody needs that only a few people can afford. They need a massage therapy, they need acupuncture, they need chiropractic care, they need a doula. And they're like, oh, we need car seats, we need breast pumps, we need actually gift certificates, because cash is probably the most important thing to a lot of families that we work with. And they are like, okay, sure. Here's this big basket of things we're going to do for every pregnant member. And they get all of it from their health insurance. That's wild.
Unheard of.
But they have the ability to enact change that we don't have, because they have so much income.
That's terrific. You know, Tara, that reminds me too something else I definitely wanted to ask you about because you had mentioned Medicare reimbursements, and it's no secret. I mean, you hear about the big corporate-run hospitals
Yeah.
complaining that you know they're half of what it's costing them, and that's part of the reason they're running themselves into debt.
Yeah.
Are you facing the same issue here?
Of course. You know, and I'll just give you some very simple numbers. If you were to have a normal, healthy vaginal birth in the hospital, even with an epidural, they'll probably get reimbursed around 15,000, 20,000 from the insurance companies. Here in our practice, where they deliver with no epidural, very minimal intervention, we do have tubs, which is hydrotherapy. We would get reimbursed about $1,700. As a birth center, they would also offer a facility fee. Right now, our facility fee is $1,700. We fought tooth and nail at this last legislative session and increased our rate to $2,800 a birth for the facility fee, where they easily give a facility fee for $15,000, $30,000 if there's a C-section, $125,000 if it's a NICU admission. And here, you know, our families have a 30 to 40% chance of having a C-section at the hospital. But here in our clinic, we've come down to 3 to 6%. So we are saving millions of dollars from not having surgeries, from not having NICU admissions, and it's the same exact population. The difference, the magic.
Prevention of hypertension and diabetes too.
Yes.
We're saving downstream
We're
millions
saving
of dollars.
downstream.
Midwives all over the country save the national healthcare system millions and millions of dollars through prevention.
And we're worth $1,700. I can't keep the lights on at all with that. And the only way we could do that is if we did 50 births a month. And none of us can do that. You know, we are on call 24/7. It's not like you're in the hospital where if you have a hospital birth, you join a practice of, 16 providers, even 10 providers who share call 3 or 4 days a month. So you never know who's going to be at your birth. But here, it's our commitment that you know who's going to be at your birth. You know which midwife will be there. And if she's not, you know her partner. And you've met with both of them. So you know who's going to be there, which we can't, nobody is guaranteeing that. And we're one of the only practices left, if we're not a solo practice, that says we believe in continuity of care. We believe in relationships. We need to trust each other. And that's where the true healing happens, is in those pregnancy visits. And that's where you can trust your midwife when she says you're going to be okay and you want an epidural. You're like, you hear the ambulance, you're like, that's my ride. But the midwife will say, we're going to just get through 3 more of these contractions. You can do it. And you're like, Jody Lynn said I can do it, and I will do it. And then the baby's there, and you're like, I did it. And she can just look at somebody and know that mom's in contraction or in transition, and just know, like, baby's coming. She can get through this. And there's these moments where we really see people at their best, their absolute best, and seeing them overcome what they thought was the hardest pain in their life, and then seeing them welcome the most joyous moment of their life, it's pretty awesome. It's a pretty awesome transition. And then 10 years later, we watch them welcome somebody else into the world. It's just, we've learned so many life lessons in this work. And that's why, we don't do it for the money. We do it for the work that's out there in need in our community. We do it for our families. And, my family has so many of my generation. We're just one generation removed from immigration. And they've all had C-sections, NICUs, we've all had hypertension, gestational diabetes. That's why I do this work. I'm helping my cousins, I'm helping my sister. And now we need, more than ever, we need more help with this next generation. And now these pandemic babies, we don't know the mixed bag that's going to happen. Even pregnancy, getting pregnant after having COVID, we've seen the worst hypertension, gestational diabetes. We've seen so many crazy things that we've never seen before in
Yeah.
years, ever.
It's COVID.
It's COVID.
Yeah. It's not benign. It really impacts people, their health and the pregnancy outcomes, and we need that pathway to support and help in the hospital system to be really highly functional and working really well for everybody.
So I've already kept you both entirely too long, but the last thing I wanted to ask is just a basic question. If a mom to be is looking at where she's gonna go, do I go to the hospital or do I go see the midwives? What do you tell them?
People birth where they feel safest. And you don't have to decide that today. And we help you through that process because we don't know what's safest yet. And you will know, and it takes 40 weeks to grow a baby. And it takes that long to prepare yourself to become a parent to this little baby. And where you deliver is the last day of your pregnancy. We really care what happened that whole time leading up to that last day. So if we do our job right, they can deliver anywhere and they'll be okay. And we will create that pathway wherever they need to go. And we'll make sure that they arrive healthy and safe and welcomed with wherever they go. And so we don't know, and that's why it's so important to have hospital relationships that are just so amazing, and they welcome you, and they come into our clinic and teach here, and we go there and we learn from one another. We have to collaborate. We need each other. We need the hospital system. We need our nurse midwives. Like, they have changed. It's game changer.
Yeah, I think that's the biggest thing, is that influence. It's not like, because if you look percentage wise, we're caring for such a small percentage of families, but there's the influence of that person who walks in and sits down and says, I don't know what I want. I don't know what I'm doing. I don't know anything about any of this. What can you tell me? Where should I go? Having a midwife on the other end of that conversation, to midwife you through the learning and through the exploration. Many, many times we have families choose to even move their whole care in with the doctor or a nurse midwife in the hospital system and support them the whole way and stay in touch with them, and we provide a supportive role for them while they're getting their health care in a different system. Many, many times we have people who are like, I really want to have my baby in the hospital, but I am not leaving you. And I'm going to do all my prenatal care here, and I'm going to go to the hospital, and that's how it's going to be. And we're like, great, we have a system for that. We got a program for that. And it's really to the credit of our first partnerships our early partnerships at Cherry Hill, and some select doctors, and our current partnership with Virginia Mason that we're able to provide that answer for people of, where do I go and what do I do? We're very lucky as humans. We get 40 weeks to be pregnant, and then we meet our baby, so we get to prepare. Then you get 3 years before you have to deal with a 3-year-old, and then you get 14 years before you need to deal with a teenager. And hopefully all along the way, you're preparing and you're learning and you're unfolding who you are as a human and reaching your own potential, and you're able to give to your children. And we know the first day we meet you, we got the long game in mind. Mm-hmm. This baby is going to arrive to parents who are ready to receive that baby in health and strength, physical and mental health and strength.
That's great, because mine's 23 and I'm still not prepared. So
I have one of those too.
I appreciate that.
They're very confusing.
Indeed. Joey Lynn, Tara, thanks so much.
You're